All right, let's talk about X-raying the shoulder blade, or the scapula. Sounds simple enough, right? Well, it's actually one of those bones that's surprisingly tricky to get a perfect image of. Today, we're going to master the two essential views you need and find out exactly why it's such a challenge.
So what's the big deal? What's the central challenge here? Well, the scapula isn't like a bone in your arm that's just kind of out in the open. It's this flat, triangular bone that basically floats right up against your back ribs and your lungs. All that stuff creates a super busy, complex background, which makes getting a clean diagnostic image incredibly difficult. So how do we solve that?
Let's start by really digging into that anatomical problem. Because once you understand why the scapula is so tough to image, getting that perfect shot becomes a whole lot easier.
The main villain here is something we call superimposition. The scapula lies directly over the ribs, and then you've got the lungs behind them adding even more visual noise. I've always thought of it like trying to photograph a delicate butterfly on a really busy, patterned carpet. Our job is to find a way to make that subject, our scapula, stand out from the background.
Okay, so our first solution, our first tool in the toolbox is the antero-posterior projection, or as we all call it, the AP view. This is our go-to for getting a clear, straight-on look at the scapula.
The whole point of this view is right here on the screen. It's not just about taking a picture of the bone. The real goal is to get a picture of that bone without the ribs getting in the way. It's a very specific mission, and it demands some really precise positioning.
So how do we pull this off? First, we get the patient into an upright position. It's just way more comfortable, especially if they have a sore shoulder. Now, here comes the key move. We have them abduct their arm 90 degrees. That just means lifting their arm straight out to the side. What this does is it physically pulls the scapula laterally, sliding it away from the rib cage. And finally, this part is absolutely crucial. You have to make sure the patient doesn't rotate or lean their body. The second they do, all that hard work is undone, and the scapula just slides right back over the ribs.
Now here's a really cool trick for this view. It's kind of like our secret weapon. We ask the patient to take slow, shallow breaths during the exposure. Think of it like portrait mode on your phone's camera, where it blurs the background to make the person stand out. It's the same principle. The gentle, constant motion of breathing blurs the details of the lungs and ribs, while the scapula, which stays relatively still, remains sharp. This little technique makes the bone just pop right out of the image.
All right, so you've made the exposure. How do you know if you nailed it? Here's your quality checklist. First and foremost, is the lateral or outside portion of the scapula free of the ribs? If you can say yes to that, you're off to a great start. Next, is the scapula itself sitting nice and horizontal, not slanted? Can you see all the fine bony detail right through the lungs? And finally, did you get the entire bone, from the acromion at the top to the inferior angle at the bottom? If you can check all those boxes, you've got yourself a perfect AP view.
Okay, so we've seen the scapula face on, but what if we need to see it in profile, from the side? That's when we move on to our second essential projection, the lateral scapula. It's often called the Y view, and you'll see why in a moment.
The goal here is completely different from the AP view. We're not really looking at the flat body of the bone anymore. We're looking at its relationship to the other structures around it, especially the head of the humerus. This view is absolutely critical for spotting fractures along the edges of the scapula, or, very commonly, for checking if a shoulder is dislocated.
And what's interesting is the setup is basically the exact opposite of the AP view. Instead of moving the arm out from the body, we bring it across the body. And instead of keeping the patient perfectly straight, we deliberately turn them at an angle. Every step is designed to achieve that perfect profile. Let's break down that setup. The patient is upright, and we rotate their body into an oblique position, either a right or left anterior oblique, depending on which side is hurt. Then, we have them bring their arm across their chest and just rest their hand on the opposite shoulder. This simple little move is key because it rolls the humerus forward and completely out of the way, giving us a clean, unobstructed shot of the scapula's body.
So what's our quality check for a great Y view? Well, the number one sign of success is perfect superimposition. The lateral and medial borders of the scapula should line up so perfectly they look like a single sharp edge. Beyond that, we need to see that the body of the scapula is clear of the ribs, and that the humerus isn't overlapping the area we need to see.
So we've covered the setup for both of our views. Now let's put it all together and really see how these two different images work together as a diagnostic pair. This table really breaks it down perfectly. Notice that one constant. For both views, the scapula must be free of the ribs. That's always goal number one. But after that, the goals are polar opposites. For the AP, we want those scapular borders seen face on, not slanted. For the lateral Y, they have to be perfectly superimposed. And the humerus? Not a big deal in the AP, but it's a total deal breaker if it's in the way of our Y view.
So as we wrap up here, you can see it all comes down to one core concept. In radiography, every single movement you make, every instruction you give the patient, it all has a direct and predictable impact on that final image.
And this really is the crucial point. Getting a great X-ray of the scapula isn't luck. It's not a guess. It's the direct result of understanding the anatomy, knowing the goal of each and every projection, and then executing that positioning with absolute precision. It's the art and science of our field, all distilled into a single, perfect image. It makes you think, doesn't it? What other simple X-rays are actually surprisingly complex? That's something to think about. Thanks for watching.